Hello and welcome to this recorded presentation for the employees of KPG Healthcare for the health plan benefit year starting January 1st, 2023. This presentation is specifically for the internal employees for KPG. My name is Bill Hammett. I'm proud to be your insurance broker, your insurance expert, happy to help in any way throughout the enrollment process or throughout the year. The dedicated account manager, Rhiannon, and benefit administrator, Anna, are also available to you. They're great throughout the year for claims issues, for finding doctors, for understanding the process of the benefits, for those more personal, higher end questions about what's the right plan for me and examples of particular medical issues you would like help understanding the best plan for. I'm a great resource for that. So please reach out. Quick agenda on what to expect, our timeline of open enrollment. We're going to talk about open enrollment, but for those of you watching this video throughout the year, all the information applies the same for you. When you're hired, you're basically in your own personal open enrollment. Talk about medical, dental, vision, life, disability. We'll go through some screenshots of how we're enrolling. It'll be through your iSolved system, the same system that you do your payroll through. And then questions we just talked about. We're a resource for you if you need us. So what is open enrollment? Open enrollment begins November 14th, goes through November 23rd. There are some available permissions to go past the 23rd. We understand this is a complicated matter, and you might need a little bit more time than November 23rd, but please stay in contact with your HR department on those needs and reach out to us if we can help you with questions. As a reminder, this is your time to enroll or waive in benefits. You can add or waive your dependents. You can move from one plan to the next. If you had the really expensive PPO plan and you want to save some money this year, this is your time to change. If you want to add a kid, remove a kid, add the dental, remove the vision, whatever it is, this is your time to do whatever you want to do. Any changes you make will be effective January 1st, 2023. We're asking you to please try to hit the Wednesday, November 23rd deadline, and you'll complete your applications online at the iSolved benefit portal. So the medical plans available are within United Healthcare. We have 3 to 5 plans. The reason why it's 3 to 5 is if you're in California, in addition to the PPO plans, you have some HMO options. For those of you outside of California, they're not HMO options. Most of you are on the PPO plan, so we'll kind of get into that. Here's our 2 HMO plans. Again, this is only for California employees. These HMO plans have a lower price point, have some good copays available, but they also have a limited selection of providers. So especially in the northern part of California, not quite as heavy of a Harmony HMO network up there. There's the high option, which is a lower deductible, lower out-of-pocket maximum, low copays. And then there is the low option, which are higher deductibles, higher out-of-pocket, higher copays. All right. So our PPO plans, we've got 3, and everybody is eligible for these. We have our high option PPO plan, which is a $500 deductible this year. Last year it was a $250 deductible. So we found we were able to save some money by moving the deductible up to $500 from $250, which will directly translate into some lower prices for those of you enrolled in these plans. The out-of-pocket maximum is $4,500. The doctor visits are $20 and $40. You can see in the mid-option plan, which is our most popular plan, is our $1,500 deductible, $5,000 max out of pocket. And then to see a regular doctor, it's $25, a specialist, it's $50. And then our low option plan, this is great for those of you that just need a couple of doctor visits, maybe a couple of prescription drugs, but other than that, not using your health plan too much. This low option PPO plan, high deductible, $3,500, that will come into play when you're getting MRIs and hospital stays and surgeries and stuff like that. But for those of you just getting doctor visits, regular doctors, specialists, prescription drugs, there will be copays for all those things. So let's look at that mid-option PPO plan. I just want to kind of go down the line and just tell you what you're looking at. So first, the deductible. A deductible is, generally speaking, what the insurance company says. You must pay all of this number before we start paying for any portion of your benefits. Now, there are some exceptions to this. We just talked about them. A primary care visit would be $25 deductible waived. A specialist would be $50 deductible waived. You can get virtual appointments for $0, all the way down to urgent care, $50 deductible waived, and then prescription drugs. Generic drugs you'll pay 10 for, and then brand name drugs, depending on what formulary brand or non-formulary brand tier they fall in, you pay $50 to $100. So in the middle there, we have a bunch of percentages. It says 30%. So what that means is this. If I'm on this plan, my individual deductible is $1,500. That means if I go to the hospital, I'm going to pay the first 100% of the first $1,500. So 100% of the first $1,500. After I've spent that, then United Healthcare pays 70% and I pay 30% of the cost until my 30% plus my deductible gets to a $5,000 maximum out of pocket. That is the ceiling by which you will, once you hit that number, you are not on the hook for anything else for the rest of the calendar year from covered services and in-network providers. All right. So that is your maximum risk. You'll see family, we have the number goes double. This means that any family would have no more than a $3,000 deductible and no more than $10,000 out of pocket. What's important to note about those numbers is while the total cost doubles, no one person inside the family unit would have to pay any more than the individual deductible or individual out-of-pocket maximum. I'll say it again. When you have a family deductible of $3,000, one person in the family goes and gets surgery, they will have met their deductible in full at $1,500 and then get into that 30% co-insurance. And then the rest of the family has the other $1,500. Okay, so no one person pays any more than what their responsibility would be as an individual. So in that example of me having my hospital stay, let's just say it's a $100,000 claim. I pay 100% of the first $1,500. Then I pay 30% until my total out-of-pocket expense, including my deductible, equals $5,000. At which point the United Healthcare would cover the other $95,000, and I wouldn't pay anything else the rest of the year for covered services. My family would have the other $1,500 deductible and the other $5,000 out of pocket. They can hit that cumulatively, or any other one person can hit it, but basically it doesn't get any higher than those numbers for a family. All right, let's talk about our dental plans. We've got 1 to 2, depending on where you're at. If you're in California, you have access to the HMO dental plan. This plan is low cost, but low choice, right? So HMO dental plans are really great because there's not a lot of out-of-pocket costs and premiums, and then everything's a copay. But the trade-off is there's limited availability of dental providers. Our PPO dental plan is available for everybody. This is a pretty good dental plan. Even the best ones don't knock your socks off, but this is a good one, all things considered. It is a PPO dental plan through United Healthcare. If you need x-rays and cleanings twice a year and all those kind of things, that's preventative services. That's covered at 100%. Basic services, such as just regular cavities, or all the way up to endodontics, periodontics, which would be root canals or deep cleanings, that's covered at 80%, meaning you pay 20%. Major services, once you get into the big stuff like inlays, crowns, dentures, it's a 50-50 split. There's a $50 deductible per person, no more than 3 of those in a family. And the maximum benefit in a calendar year is $2,000. So what we talked about with medical, where once you hit your maximum, then the insurance company pays everything else and you pay 0. With dental, this is the exact opposite. Once United Healthcare has spent $2,000 on benefits for the claims that you've had through your dental work, they will pay no more. They are 100% done, and you are 100% on the hook. So for the rest of the calendar year. Now, on January 1st every year, no matter when you started this plan, you get a new $2,000. Also, for the out-of-network benefit, there's this plan when you go to non-network dentists that are not in the United Healthcare PPO network, it pays for 90% of what's considered usual and customary charges. When it comes to out-of-network dental PPO benefits, this is as good as it gets. This is the highest amount of reimbursement, which means the difference between what the dentist wants to charge you and what United Healthcare pays will be smaller than your other average dental plans. But I would recommend strongly that you do not actively go to out-of-network dentists, because these dental benefits just won't go nearly as far as if you go to an in-network provider. Let's talk about our vision benefits. We got one plan from United Healthcare. It's a good one. It's a United Healthcare vision plan. It gives you a $10 eye exam once a year. It gives you $25 copay for new lenses once a year, $25 for contacts instead of glasses. Once a year, you get a $180 allowance for frames. So that's a good benefit. And then if you need necessary contact lenses, it's $25 copay there too. So good benefits once a year. This is how you differentiate between a good or an average vision plan. Do they make you wait 2 years for some of these services or just one? This makes us only wait 1 year for all these things. So it's a good plan. So let's talk about our technology around our health plan. The number one thing you can do to improve your healthcare experience is download the app onto your phone. If you do this, you will have access to your ID card, access to doctor network, access to your benefits. You can look up your claims information. You can talk to doctors 24/7. You can do video visits. You can do all kinds of stuff for yourself on your phone. We're doing it with everything else in our life anyway. Let's do it with this as well. So please do that. Also, there's the just myuhc.com, their online portal, which has got even more stuff. So please do that for yourself. Engage in the technology they provide for you. It'll help you answer a lot of your questions. It'll help you get to the places that you need to get to. It'll give you the resources and the ability to have a better experience with your healthcare plan. So let's talk about our life insurance, disability with Unum. We've got life, disability, employee assistance program, and more from Unum. That's a really good insurance carrier. So lots of different products here. Short-term disability is not available in California because Californians, we have our own disability policy that we pay for through our paycheck. So that's not going to be for you there, but everything else is available for you. So let's talk about our short-term disability. Again, California employees do not have this. Short-term disability, after a 7-day illness, and illness is even could be anything from injuries and cancer and digestive orders to just pregnancy. So after 7 days of being gone on a disability, then this policy would kick in and pay you 60% of your weekly income not to exceed $13.57 a week. So that's a good deal. And this could last for up to 52 weeks. So that's a really nice benefit. So if you have a C-section with a baby, you get 8 weeks of disability. If you have a normal pregnancy and normal delivery, then you would have a 6-week disability policy. Everybody gets a long-term disability policy. This is a policy that after a year of being disabled kicks in and pays you 60% of your monthly income up to a maximum of $13,000. So sometimes disabilities last longer than a year. Sometimes they last for decades. This is a policy that would continue to pay you all the way through your Social Security age. So it's a really nice benefit. Lots of information there you can find with Unum. Again, this is another site to log into and register with. A lot of these benefits, when you're enrolling, you're going to see these in the portal. These PDFs for you to review. A life insurance policy, the company pays for a $25,000 life insurance policy for you. You get for free. It's a company paid life insurance policy. Everybody's got to take it, and it's free money. It's a nice little thing to have, and it's a benefit from your employer, paid for by them. So all of those items were all paid for by your employer. Now we get into a voluntary term life policy. So for those of you that are enrolling for the first time, you just got hired, you're just becoming eligible for this policy, you are eligible to enroll for up to $70,000, no questions asked. Your health status doesn't matter. You can get up to $25,000 for your spouse and up to $10,000 for each of your children, no questions asked. Now, if you are at open enrollment and you did not elect this benefit previously, or if you did not do this when you first enrolled, any amount that you select will trigger what's called an evidence of insurability. This is just a quick little questionnaire about your current health status. It is not terribly invasive. It is relatively easy to pass, but they do ask some questions. So just know that if you're applying for life insurance anytime after you first got hired, you're going to have to fill out a little health questionnaire. You can ask for up to $500,000 as long as it's not more than 5 times your earnings. So you can request a lot of life insurance money here, but again, they are going to ask you some health questions. All right, so some of the value-added things that just come with Unum's policy is an employee assistance program, which is a really important first step in a mental health journey. If you're having issues with stress, depression, anxiety, relationship issues, anger, grief, loss, stress, work-life balance, family problems, elder care, lots of different things these guys can help you with. You can call the number. You could get up to 3 in-person visits, no cost to you, but it's a really, really nice benefit. It's a really great place to start. There is support 24 hours a day, 7 days a week. So if you're in a tough spot, this is a very, very good place to start. It is a benefit that you get for free, and something that I think some of us could really take advantage of. Coming along with this employee assistance program is a medical bill saver. So if you find yourself with like out-of-network charges that are, exorbitant, and you go to a dentist and they're not covered and they want to charge $5,000, you can go to the medical and the dental bill saver product, and they will help you negotiate those numbers down. Very, very effective. So many people save hundreds of dollars when they use them. So if you find yourself in that situation, this is another added value benefit. And there's a travel assistance program. So whenever you're 100 miles or more away from your home, this is a program you're going to want to remember you got. Download it and activate the app on your phone if you're traveling outside the country. If you end up in a medical situation, your health plan will cover you anywhere in the world for an emergency, okay? But it doesn't really help you in the moment. You still need to negotiate that healthcare system. You need to negotiate the language barriers, if any. So having this travel assistance program, a multilingual advocate for you that can help you through the process and help you get the care you need. So another really great product for you. So let's talk about our enrollment. How are we going to enroll? Again, it's going to be through our iSolved payroll portal at employeedrive.myisolved.com. You should know about this. You'll see the open enrollment tab on the left menu bar. I think you also say something to the extent of employee self-service. You hit that button and you get into your enrollment. You're going to be able to see what you had before, if you had something before, what you did, the names of your beneficiaries and dependents. It's going to go through you adding all this information if you haven't already. You'll see different information about the benefits that are available. Once you get to your medical plans, you're going to have the ability to select plans. You'll see them listed there. You'll hit the select button. Down here on your bottom right, you're going to have access to some additional links and different pieces of information that can help you understand the plans better. If you're waiving coverage, you would just give a reason why. Other is an acceptable answer. When you're selecting coverage, you're going to see the different tiers that you can select. If you select employee plus children, it's going to ask you who's enrolling. You can check the boxes if you didn't want to enroll some of the people. Maybe you have multiple children and one doesn't need the coverage. Once you complete it, you're going to be given a little look at how your dollars are spent on an annual basis. You can change a lot of these numbers. You can see or change the annual to monthly to paycheck, and just kind of see how much of the pie, of your benefit pie, you're spending on different benefits are available. Once you're all set and all done, you'll find this button at the bottom that says Submit Benefit Elections. You'll hit that. A window will appear and ask you to verify and certify that you want to submit these. You'll hit OK, and you'll be all done. So next step is for you to log into your iSolve account and begin the enrollment process. We're asking everybody to be done by Wednesday, November 23rd. If you have any questions, you need any answers, we'd be happy to help. It's our honor, it's our pleasure to be your broker. I look forward to speaking with you if you have any questions or need anything, and I hope you have a great day. Thank you for listening.